I'm Dr. Bob England, Pima County Health Director, and this is your Pima County Public Health Update for May 27th, 2020. Let's talk contact tracing today because a lot has been made of it. Really high expectations are being set. Public health has done contact tracing for certain diseases for decades and decades. They tend to be diseases which are relatively uncommon and for which we have a good intervention, a treatment to prevent disease in the person who's been exposed. So pertussis, certain sexually transmitted diseases, on and on. This is different. We tried to handle this the same way we do other diseases for which we don't have that ability, like the flu. We said it's here, everybody has to act in a certain way. But very quickly, society made the decision that this disease is bad enough that we went into lockdown. We essentially quarantined the whole population. So in order to get out of that, now we're going to bank on isolation and quarantine of those folks we can identify who've been exposed in order to let everybody else go about their business. So here's how it's got to work, though. We get a lab report of a positive. We have to first go back to the provider, get the phone number and other identifying information about that person, call that person up. They've got to answer the phone. Sometimes it takes a while to get a hold of people. Then we've got to interview them, identify likely contacts, which sometimes is easy, household contacts, sometimes isn't. We've got to talk to all of those folks. We've got to ask more probing questions than we have been. We've got to identify clusters of cases quicker so that we can intervene more efficiently in workplace outbreaks or in congregate setting outbreaks. Then we've got to monitor those contacts for symptoms and get them tested as quickly as we can if they become symptomatic, and then start the process over again. Well, how's that working? Take my example as an example. You guys know I was sick last week. I started getting sick on Saturday. I got my nose swabbed on Monday, a week ago last Monday. This is now 9 days out. I'm still waiting for my test result. And that's nobody's fault. The lab's just backed up. I'm not alone either. There are several hundred, perhaps thousands of people in our community in the same boat right now. So it's one thing to say we've got plenty of testing, now we can do contact tracing. It's another thing to say, well, we've got testing, but can you get an answer fast enough to do anything about it? That being said, this isn't going to be perfect. Just like social distancing isn't perfect, the 6-foot thing, wearing masks, will slow down transmission. It won't completely prevent it. Same thing's going to happen with contact tracing. You just got to expect there's going to be leaking around the edges, no matter how well we do this and how hard we try. And with that unfortunate dampened expectation, this has been your Pima County Public Health Update.